areas that, what separates us from the average pain guy, the average doctor out there doing pain. That guy's treating medial branch nerve blocks, ESIs, maybe some SIs.
Yeah.
I think they're quick to move to spinal cord stimulators and interstitial pumps.
And drugs.
Yeah. And give lots of drugs. I actually will say I think they're moving away from drugs more, but there's still quite a few of them out there. The things that separate us is the ability to use ultrasound, that we can see these muscular structures, tendinous structures, the
soft tissue.
Right, the soft tissues that's not bony.
Yeah.
The ability to do a trigeminal. That case that you did was, that's life changing. That's just absolutely crazy, to be able to do that.
It was, and the fact that he'd been in pain for 5 years, that's crazy. And we weren't the first, this was like, I want to say it was like the 7th or 8th provider that he had been to, and they all did the same thing. They said, here's some hydrocodone, and he's even, when you're in pain for 5 years, of course you're doing research, of course you're doing your own, what other options are there? He knew there were other options, surgery and different, maybe not ones he wanted to try, but even when he came here, he was like, you're telling me there's a nerve block you can do? He was just completely like, what? For 5 years, what? Understandably so, he was upset. I think it took him a while to, afterwards, when you've been in pain for so long, and then just all of a sudden somebody turns that light switch off. It's like it's got to mess with your head a little bit. Kind of like the lady, the TC faculty.
Oh yeah.
It's almost like they don't believe it. It takes them a bit to kick into okay, when's it coming? Your brain's just so used to it.
Her sister said it took months for her to believe it wasn't going to start hurting again.
Yeah.
She said it's not hurting yet. She told her sister, well, it's not hurting yet.
Yeah.
I'm like, well, it's
like in
6 weeks. She just was. It's going to come back because it's always came back. It's always never been more than a couple of days.
Yeah.
So
it's crazy too when you think about these people go. Her norm was getting an injection, getting pain relief plus or minus for a week, maybe 2 weeks
at most.
And her world, that was pain management. That was
and drugs. Sadly, she had gotten addicted to the drugs and was in rehab trying to get off of them. It's in a way it's very sad because when when I talked to her sister trying to say, and I think I know what this is, and it's going to be really simple, but my worry is her mental state after that. Now if I make her better with a really simple injection, and she's gone 14 years,
it's like wasting time.
It's 14 years of her life totally wasted
that she can't get back.
I told her sister, I don't know what's that going to do to her mentally.
Yeah.
And I needed some confirmation that I should go forward with it.
Yeah.
I didn't know if that was something I should just make that call on, and they wanted me to, but and I think she struggled with it for months. What she had been through,
right?
Kind of unnecessarily, at least to a degree. I'll be the first to say that if I'd been the first to see her, would I have tried the injections and the medicine and the I did have the benefit of knowing that they had tried for 14 years to treat this and it didn't work.
Right.
So I had that prior benefit, but
the difference is that you wouldn't spend 14 years trying the same thing
over and over again.
Over and over.
Exactly.
I think that's the part that blows my mind is who in their right mind is going to do that? Who, as a provider, can you, in good faith, I can't say, we're coming up on 10 years. At what point do you just say, all right, maybe this isn't it. Maybe this isn't the thing that's causing you pain. Like, maybe let's try. Like, I don't know. And you're right. I remember when you came up and you were like, hey, she's got, to explain the symptoms. She's got pain with forward flexion, real point tender in the back, and you just looked at me and I said, cranial nerve? Yeah, that's what I was thinking too. And like, I don't know. I just remember her getting up and she had this kind of strange look of like, yeah, it's better for, you could tell she was like very stoic and like, yeah, it feels better now.
Yeah. And I think she had experienced that before. That the injections they had done before did relieve it for a few days, a couple of days.
Yeah.
But never long term. So, ultimately, the answer is when they get long term relief.
Yeah.
It's not always that okay, I'm better for a day. Although sometimes we do diagnostic injections that are truly just that, diagnostic. I just need to relieve your pain for a day to prove where it's coming from, but that's not when it's a therapeutic injection. Right. When we're trying to do therapeutic injections, we're trying to get long-term relief. A day, a few hours is not, you and I both know, if I do something that I was trying to get long-term relief out of, and I see them back at 2 weeks, and they said, yeah, it worked for a day, but I was hurting again 2 days later.
Yeah. I
freeze and go, I don't think we were in the right place then.
You dang sure aren't going to say, well, let's do it again.
Yeah, let's do it again for the next 14 years.
Yeah.
It's sad. I had a guy, of course your guy, you just did trigeminal nerve block for, and it's been 5 years, but if you remember right, it was only a few months ago that the gentleman came to me with trigeminal neuralgia. I had a left-sided trigeminal neuralgia guy. Well, his started in 1996. What's that, 30-something years?
Jeez.
I'm not doing the math real well, but 30-something years of trigeminal pain. So his story was he developed trigeminal on his left side. Within 3 or 4 years, he had a Morton's neuroma removed from his right foot, and then he developed CRIPS, complex regional pain, in his right foot. I asked him, is his nickname Lucky? So as the years went by, the trigeminal pain got so bad. He said that all his teeth have been reconstructed because he would clench his teeth in his sleep so much that he exploded his molars. He shattered all of his molars, had to have them all rebuilt, all capped and rebuilt, permanent implants. The crypts in his foot, after a couple of years, started jumping right and left foot, started moving from foot to foot. He couldn't sleep with a fan on, he couldn't sleep with any kind of a sheet, anything touching or blowing on his skin. Yeah, he was certain. When he had gamma knife radiations to the brain, he had tried to have balloon rhizotomy to the trigeminal nerve. All of those things helped for a short time, but never longer than a month, 30 days at a time. When he came to me, he had sores all on the side of his face. I asked him what that was about, and he said he said, when I fall asleep, he said I claw at my face unconsciously in my sleep, and he said I pulled the skin off my face. So, you know me, I like sympathetic blocks.
Yeah.
Because he had these other treatments for the trigeminal, and had been going since 1996, I really thought in my head it could possibly be some sort of a sympathetic mediation, because he actually developed CRIPS in his foot also, which is a sympathetic pain. So I was reading between the lines, kind of putting some things together, making some assumptions, but I said, well, let me try a sympathetic nerve block, a cervical sympathetic, versus going straight to a trigeminal. So I did a left-sided sympathetic block. the crypts in his, he came back a week later on follow-up. The crypts in his right foot was totally gone.
Really?
Totally gone, which is not supposed to happen.
Let's say, makes that make sense in our head.
Now, I don't know, unless that's just a centrally mediated sympathetic pain that the brain perceives something that wasn't there. We reset that system with a sympathetic block, but his crypts in his foot went away. The trigeminal pain, he said, was reduced at least 50%.
Really?
I repeated the left-sided sympathetic at a week. On follow-up, 2 weeks after that, he was pain-free for the first time since 1996.
Okay.
In his whole body. He just sat there and cried and talked about it. So
it is amazing what, and I think how, I mean, you and I see it all the time, how overlooked sympathetic blocks are. You know, and I think my thought traditionally on it is, you know, doing it with fluoroscopy, and I've done it. I mean, I've trained on how to do it with fluoroscopy. But you know, by doing it with ultrasound, you go through one of the great vessels, one or both, every time you go straight down there. And so I think the reason it's fallen out of favor is because folks get hematomas, they get, you know, nerve damage, they get all these bad things that happen from it, and maybe or maybe not they get a good result. But I mean, I don't know, if you can do it unobtrusively, accurately, repeatably with ultrasound. And I think that's the thing, is that just not many people do it that way. And so
I don't think, I totally agree that I think it fell out of favor. It was never accepted as a great or a good therapeutic injection for pain. And if in my opinion, I don't know exactly why people didn't use it 30 years ago or 20 years ago. But my opinion is that because we were doing it with fluoro, we were traditionally getting an inaccurate sympathetic block.
Right.
And so you were getting an unsuccessful sympathetic block, and therefore your results were not good.
Yeah.
And it was a 50-50 shot where it was going to help anybody.
If even.
Yeah. And so people just accepted that it wasn't a good injection for pain.
Yeah.
When what you and I have seen after close to 3,000 sympathetic blocks, we never don't get a good Horner's and don't get a great sympathetic block.
Yeah.
And I think because of that, we're seeing how many things it will actually help.
It actually does help.
Because we're getting accurate sympathetic nerve blocks. Not iffy blocks or maybe blocks or questionable blocks. We're getting accurate, dense sympathetic blocks, and that's the difference.
It's crazy because, and I know you've seen it too. By the time I take my gloves off and say, "You doing okay?" and I mean they're they look like a pirate. They got the and I had it was a young lady who she said they were doing a stellate using fluoro, and she goes, and then the injection, she used the term, it exploded on me, and I was like, I said, what do you mean it exploded on you? She goes, like, literally the injection exploded on me. I said, you're gonna have to explain a little further. She said, when they put the syringe on there, I guess he didn't tighten the syringe down and started to push. She said it fell off the needle and it just like went all over her face, and they wouldn't let her, her family back there with her, and then they sedated her to no end, and so she was asking questions, sedated, and they're trying to, I'm like, that's not how this should go.
It's not.
And so after she got, and I'm trying to explain to her, the symptoms, you're gonna feel all this, and I came back, I said, was that anything like what you had? She goes, not at all, not at all. And I'm like, well, that is a sympathetic block. That's what you should experience with this. And she was like, and of course her symptoms got better. But I'm like, and it's hard because you do hear all these people that, they get stellates here, and they don't get results. But it's a shame because then, again, historically, I think that's why it falls out of favor, because somebody does it, they don't get an accurate block, and they don't.
So they blame it on the block.
They blame it on the block.
Blame it on the block, and not it was me.
Right.
And I didn't do a good block.
Yeah. So it's, again, it just falls out of favor. Anyways.
Well, we're gonna keep doing what we do.
I like it.